All right, our panelists are coming on board. While they're coming up, I'll quickly introduce our panel. This panel is Be Your Own Champion in Your Glaucoma Journey. We have Dr. Rena Garg, who's a glaucoma specialist at Visionary Eye Doctors and Ophthalmology Residency Program Director at Georgetown University. We have Patricia Caulfield, who's a glaucoma patient and a well-known abstract artist. Maureen Farrell, the mother of a glaucoma patient, as well as an owner and principal lawyer at the law offices of Maureen Farrell. And Beata, I hope I got that right. Did I get that right, Beata? Okay. Skanecki, glaucoma patient and licensed clinical social worker. When we start the session, you can kind of introduce yourself so we know who's who. And when you answer the questions I'm going to pose for you, please remember to try to limit your answers to about 2 to 3 minutes so that we can answer as many questions as possible. Okay, so why don't you go ahead and just kind of identify who you are as we go down the row. Why don't we start here?
Sure. Hi, everyone. My name is Rena Garg. I'm a glaucoma specialist based outside of Washington, D.C. I spend time in my private practice, and I also work with the residents at Georgetown University. I'm excited to be here. Someone asked me what I hope to accomplish here when at this meeting, and I'm just here to learn from the patient's perspective and see what more we can do for our patient.
Hi, everyone. I am Maureen Farrell. I am a lawyer here in this great city of Philadelphia. Thank you all for coming and visiting it. My daughter was diagnosed with glaucoma at 10 years old due to congenital cataracts, which I also have. And I'm here to make sure that people understand that everyone's journey is different, but we're all the same too.
Hi, everyone. I'm Pat Caulfield. I am delighted to be here. I am an artist and also an advocate, patient advocate for the Glaucoma Research Foundation. I have curated an art show and auction that we have now yearly at the Glaucoma 360 event in San Francisco, and I work with artists, visually impaired artists, from all around the world. So I am delighted to be here. Thank you so much.
Hi, my name is Beata Skanecki. I am a glaucoma patient from Buffalo, New York. I also have cataracts had cataracts rather, and that placed me at increased risk for glaucoma, and I was diagnosed with glaucoma at age 9. I'm really excited and honored to be here.
Great. Why don't we kick it off with Rena?
Mhm.
So what steps should a patient take to prepare for their doctor's appointment?
So that's a great question. I think doctor's appointments can be very anxiety-inducing, and I think the first step is to think about what you hope to accomplish at the doctor's office. Speaking in terms of a glaucoma patient, if you're a new diagnosis, how much about your condition do you understand? How much about your treatments do you understand? Do you know what your medications are, what they're for, how they work? If you're having any side effects, write down all of your questions. Be ready to just ask why and to converse with your doctor and have a conversation about the things that you're experiencing. As Dr. Vora mentioned during the last panel, we unfortunately have to pack in a lot in every single day. And so the best thing that a patient can do when they come is be prepared and have your list of questions. For me, that's kind of the best thing I can see, because I know that there are certain things that have been worrying the patient or that they're wondering about, and I have the chance to address them. And it won't be like, your doctor, I forgot to ask you, and then, coming back in the room. It's nice to be able to sit and have a very focused conversation and address everything that you're concerned about or that you're wondering. And I think never forget to ask why or what. If there's even a little bit of a shadow of your doubt, be ready to ask the question. Most doctors are really excited to share the information, explain everything. And sometimes we unfortunately get so busy that we forget that maybe you don't know exactly what glaucoma is, or you don't know how a certain medication works. So take a step back and remind us that we need to break it down a little better, and just come prepared with those questions.
Great. Thank you. Well, Patricia, I'm going to ask you, does your checklist match up with Rena's, or Do you have some
Yes,
additional things like
abs-
carrying a pillow with you so you can rest while you're waiting during your visit?
it absolutely does. Having been diagnosed 15 years ago, how I prepare for an appointment now versus 15 years ago is drastically different. I was absolutely terrified walking into that doctor's office every single visit. And I think we can all relate to that. Now, I've gotten quite a lot under my belt and understand, what goes on in the appointment. But I think it's very important, as Rena said, to ask questions. Now, your doctor sees patients all day, every day, and he, knows everything about what he's doing, and you don't. So realize that you need to ask those questions and make sure that you understand the answers. And if you don't understand, ask again.
Great. Well, just back to Rena for a second. What should a patient do if they feel there's a lack of communication between the patient and the doctor? If they feel rushed during an appointment, all kidding aside, physicians nowadays are just overwhelmed with patient care. There are fewer and fewer doctors for patients out there. In other words, the density of ophthalmologists is going down, not up. So you have to care for quite a few patients. How do you handle that?
It's a good question. And it's definitely something that I struggle with. At the end of the day, we really just want to help everybody we can. And oftentimes we're squeezing in patients. We're getting phone calls to, add an extra patient on this day or that day. And so something has to give. And unfortunately, sometimes doctors can be rushed running from patient to patient just to make sure that everybody gets at least some of their time. And unfortunately, there might be some times when a patient feels rushed or feels there's a lack of communication. I think that's a real problem. From my perspective, if a patient felt that way, I would wish that they would just tell me and just say, hey, Dr. Garg, I really feel like we didn't get enough time together. I don't feel satisfied from the answers that I've gotten. And that would be a great reminder to me to, hey, you know what, let me slow down and let me make sure that I'm really giving this person what they need in the few minutes that I have with them. And so that also I know can be a little bit anxiety provoking to be so direct, but I would try your best. Either you tell the doctor directly or maybe you share it with the office manager or front desk staff that, hey, I'm leaving and I don't really feel comfortable with the answers I got, or I don't feel that I'm prepared to leave. Can I have a few more minutes with the doctor? And I think it's really important to try and address that discomfort when you're there rather than leaving and sitting on it, because it can just continue to grow and make you feel more anxious and more lost about the questions that weren't answered.
Yeah, Marina, you want to feel like you have an advocate always at your side when you're going through with dealing with the disease, especially a chronic one. So advocacy is important, but how do you approach that?
So I think that's something that maybe a lot of people struggle with, not just patients. I think even doctors sometimes struggle with advocacy, and so a lot of it is taking a step back and having the comfort in knowing that only you can express those feelings that you're feeling. And so if it's not directly with the doctor because you feel nervous or anxious, maybe trying to identify someone in the office that you feel comfortable with, that you can advocate for yourselves, and use that person as like a stepping point to getting you back in front of the doctor to answer those questions. It is a tough exercise. It's something we probably all struggle with professionally, personally, to step up into that uncomfortable zone of speaking up and advocating for ourselves. But I think one of the things that Dr. Schaefer mentioned earlier, which really struck me, is that you guys are very smart. You've learned a lot, and you're self-selecting for patients who really want to know and want to gain more out of this information. And I think that can very easily translate into your doctor's visit as well, as far as just stepping back and saying, hey, I need a few more minutes, or that didn't feel good. And I think we might be going into this topic in a few minutes, but maybe that means a second opinion if you're not getting, if you're not feeling restful and satisfied with the information you're given. I often tell my patients who seek a second opinion that, maybe I'm speaking a different language that's not translating over. And maybe someone will speak a language that's more, that you understand more, is more comfortable with you. And I think it's so important to not only identify a doctor who aligns with your treatment goals, but also can speak to you in a way that makes you feel comforted and makes you feel like you know the path forward.
Well, Maureen, you have a unique perspective being a mother of somebody with glaucoma. And also your profession, how do you recommend advocacy to patients or their family members?
So being a lawyer, it's very tough because, as we all know, lawyers have a certain way of advocating, let's just say way, and it can be very aggressive sometimes. And having a daughter with glaucoma who says, "Mom, you're an embarrassment. Stop, keep your mouth shut. Don't say anything in the office, okay? Don't say anything." So I'm having to walk this fine line of understanding advocacy for her, okay? And then being a parent, I'm feeling a certain way. And being a lawyer, I'm feeling a certain way. So I think advocacy is specific to the individual. Some of us are not going to be great advocates, but some of us know people that they can bring with them to be great advocates. Okay, and advocacy is different for everyone. Today, we're all advocates. We're all here learning. That's advocacy. Legislation is advocacy. Training is advocacy. So when you go into the appointment, sometimes things happen that you might not be comfortable with. And if your child's sitting there, you don't necessarily want to get into some kind of a three-way conversation that may not be productive. So as a parent, you need to figure out, okay, am I advocating for myself as a parent? Or is this about me or is this about my child? And I've had a lot of discussions with my doctor, with my daughter's doctor, I should say. See, there we go. Offline, that she doesn't even know about. And one time she said to me, "Did you yell at him?" I said, "Oh, no. Of course I didn't yell at him, but I had words with him. But the goal is for her to be calm, okay, for you to be calm. And your frustrations, I've had to eat a lot of them as a parent because I'm doing it for her. And so it's a learning experience for me, and it's a learning experience for me as a lawyer. But it never hurts, though, to be a strong advocate, okay, to speak up because this is your vision. And so that's the time, and I've had to say to her, you have to do this, because she has to learn to be her own advocate, because now she's 22 and she is her own advocate in different ways. Let's put it that way.
Oh, Beata, you're responsible for a support group, as I understand. And why is it important to talk to your family and friends and have a good support system?
Yeah. So with regard to the support group, I assist in moderating a glaucoma support group on Facebook called Glaucoma Eyes. It was actually founded by a woman in Denmark. So it is a worldwide patient support group. We have over 20,000 members. Patients, family members are all welcome. With regard to telling your family and friends about glaucoma, I think there's so many different reasons this is important. One of them is just to encourage your family to get tested for glaucoma as well. We've heard a lot about how family history can be important. For myself, that looks a little bit different because I'm adopted, so I actually have very limited family history. But even just aside from that family history portion, I think it just lets people know how to best help you and understand you as well. My hairdresser, even, she knows that if she wants to get my attention before an appointment, she should come right up to me and maybe not expect me to see her, way in my peripheral vision off to the side, because I do have a little bit of loss there. So it just really helps people to help you, and hopefully encourages people to get their eyes checked as well. I think there is a really big misconception that glaucoma can only affect older individuals, and we know that that's not always true.
So, Patricia, what advice do you have for newly diagnosed glaucoma patients? What do you know now that you wish you knew when you were first diagnosed?
Well, that has certainly changed quite a bit. I would say to you, learn everything that you can. The fact that you're here today, you're in the right place. The Glaucoma Research Foundation has been invaluable to me through the years. Their website is just wonderful. The webinars, the information is just simply remarkable, and it's current and it's up to date. So learn everything you can. The other thing, I have learned so much just from talking to people that have glaucoma, and with working with these visually impaired artists now, which are all over the world. Their stories are simply incredible. They're just remarkable what they have been through and what they have done to overcome the fear of this disease. And that's another thing I would have to say is don't fear the visual field. Don't. Everybody, you say visual field and everybody just groans. We all hate it. But I have learned over the years that the visual field is one of the best tools for your doctor to create a roadmap for your care. So don't fear it. Go in, take a deep breath. I mean, I've started to wear loose clothing just so that I'm comfortable. And I get a song in my head or whatever, and I just let go of the fact that this is what I'm doing. If you look at it, it's 10 minutes out of 24 hours in a day. So just get through it and make sure it's accurate as it can be, because this is really going to be the roadmap for your doctor. So you have to kind of get over these fears going in, which, believe me, I would walk in that room 15 years ago in a complete panic. And learning to accept the fact that you have glaucoma, you are now going to have glaucoma for the rest of your life, and you need to find a path which you can learn to accept it and move forward and continue to live the life that you want. And don't stop doing what you love. I am very adamant about that. I'm very passionate about my artwork. I love to draw and paint. I haven't been able to because I had cataract surgery 2 weeks ago, which these lights are not fun, but it was successful. Thank you to my doctor. Just don't stop doing what you love. Find your passion, go after it, and don't let anything get in your way.
Great advice. How many of you love doing visual field? No takers. Well, it's certainly an important test, and I know it's not total consolation, but it used to take an hour to do a visual field test on the machine originally. So we've made progress in making it more palatable in a shorter period of time. So how many of you have sought second opinions? So good number of you. Just good. So I'm going to throw this question to both Rena. Let's start with you, and then let's go to Maureen about this. When should somebody really think about getting a second opinion?
So I love the fact that so many people raise their hands about second opinions. I think there is the probably well-founded conception that doctors don't want you to get a second opinion. You're going to offend your doctor, or they're going to be upset. And I think maybe at a point that may have been true. But I can say in all of the colleagues that I've spoken with, most of us love and welcome second opinions, because there's obviously a reason that you're interested in a second opinion. Maybe you're anxious about what's going on, and hearing someone validate what's been told to you will make you sleep better at night. Everybody wins. Maybe the doctor isn't getting through and you're not understanding exactly what's going on, and so you need it explained a little bit better. Again, everybody wins. I really don't think that there's any harm or anything bad that can come of a second opinion. So my suggestion to all of my patients is, when we're newly diagnosing, if there's a lot of reservations or confusion, get a second opinion. If we're thinking about surgery or intervention, or maybe starting a drop, and I see any sort of discomfort, or the patient is a little bit unsure or anxious, get a second opinion. Sometimes depending on where you live, it may be difficult. You may not have access to a second opinion, but I would say if it's available to you, there's little harm other than the time lost in the office that could come from having a second opinion.
Maureen, do you have any pearls there?
I do. I agree about a second opinion, particularly when you're the patient and you have to think about your gut instinct. Everybody has them. So when you're in the doctor's office, and I went through this with my daughter, and things are going on, so you have your child and you, And you feel in your gut that the communication is not good. And doctors are people, right? So they're all going to be different. Some are going to be better communicators. Some are going to be better surgeons. Some are just going to be better with children. This was a pediatric ophthalmologist. There were toys in the room, and we waited forever, and they were young toys, like for babies. My daughter was annoyed. So by the time you get in there, and she's waiting for 2 hours, and she's annoyed. And the doctor just wasn't right for her, getting back to that, for her. And the drops weren't necessarily, so that was the other thing, drops weren't necessarily working. So my opinion is, maybe he or she is not a great communicator, but they're fantastic. The drops are working. This is a fantastic result. So what am I looking for? I may not get the best communication all the time, but I'm getting a result. And it also is about you as a patient. I live in Philadelphia. I have access to many doctors. And even if I didn't live in Philadelphia, I would find other doctors, because that is our right to have this. Our vision is our right. And so we did go to a different doctor who was not a pediatric ophthalmologist. She was 12 years old with 40-year-olds in the waiting room. But in any event, and I think she was his youngest patient, it did work out very well. And we really like this person, and we do think he's a phenomenal surgeon. So we got best of both worlds.
Anything to add?
Oh,
Fair.
Um, sorry. It's been a while since I sought a second opinion. I actually did that back when I was a teenager. One of the reasons for that was because 20 years ago, there weren't as many doctors, at least in my area in Buffalo, willing to see a pediatric patient. So there weren't many glaucoma specialists who are comfortable like seeing a 9-year-old that was recently diagnosed. So I did actually get a second opinion at Wills Eye Hospital. Now I'm really lucky to go to a larger eye institute where there's so many different specialists available. It's a large teaching eye clinic where there's just so many different doctors. My doctor is actually here today, Dr. Saminsky. So I'm really lucky that now I have a great glaucoma specialist. I don't feel like I have to seek a second opinion. But if I was ever in a place where like I had an emergency or something was going on, I'm lucky that I'd be able to see a doctor from maybe a different background, like a corneal specialist or retinal specialist if I needed to do so. So I think seeking out like those larger teaching hospitals, if it's available to you, is great as well.
Quick question, just out of curiosity, when you first were diagnosed with glaucoma, did you understand the difference between a general optometrist, a glaucoma optometrist, a general ophthalmologist, and a glaucoma fellowship-trained ophthalmologist? How many of you knew those different categories? So some of you already knew the difference right off the bat. When do you have to go see a glaucoma specialist? When does that happen in the course of disease management of glaucoma? I'll throw that open to the panel. Anybody want to tackle that?
I can start, and then you guys want to weigh in. I think, as a glaucoma specialist, it's funny because we were sitting and a few of us were just talking about how glaucoma patients need to be with glaucoma specialists. And I think that in an ideal world, that would be the case. If you have glaucoma, you see a glaucoma specialist. But the reality is, unfortunately, even in our country, there is not always access to a fellowship-trained glaucoma specialist. So, if you live in an urban area and you have access to a glaucoma specialist, I would say if you're, high risk of developing glaucoma, if you have glaucoma, if you're considering undergoing glaucoma surgery, those are all good reasons to, at the very least, have a second opinion with a glaucoma specialist, if not ideally be fully under the care of a glaucoma specialist. Now, sometimes where we live, we can't choose and we don't have access to a glaucoma specialist. And if that's the case, my suggestion would be to see a board certified ophthalmologist if you're dealing with glaucoma, and ask that person if they feel comfortable discussing your case with a colleague who is fellowship trained in glaucoma. That may be the easiest way that you can at least get your case looked over by someone who's had the fellowship training to make sure that you're headed down the right path. And most most of us in our field, we're very collaborative. We always joke that it's a small field and it's a small world, as we like to say, but we all love working together and we want to do what's best for our patients. So many would be happy to oblige that.
Yeah, I just want to emphasize that, if you asked glaucoma specialists or ophthalmologists to take care of all the glaucoma patients in this country, it's impossible. There are just too many glaucoma patients. Comprehensive ophthalmologists are all trained to take care of glaucoma. And in fact, for most of them, it may be anywhere from 20 to 40% of their practice is caring for glaucoma patients. Laser trabeculoplasty, one of the therapies we talked about, is done mostly, almost the vast majority are done by comprehensive ophthalmologists. And they also do glaucoma surgery. Some of the surgeries you heard about earlier with Brian, like minimally invasive glaucoma surgery, the vast majority of those are done by comprehensive ophthalmologists. But certainly when there are more complex cases in terms of diagnosis, or you've failed various types of options, and you're going into more invasive surgeries and repeat surgeries, it probably does, in my opinion, that's the time to think about seeing a glaucoma specialist, at least for counseling what the next step might be in their care. So I don't know if that was the path that you all went through, but that I think is a reasonable path to pursue. Not everybody's going to be able to be treated by a glaucoma subspecialist, and they don't need to be. Comprehensive ophthalmologists do a very good job caring for newly diagnosed glaucoma patients, especially in early stages of the disease. Any other thoughts there by Pam on that? No? And if you don't have access to a glaucoma specialist, it can be a real problem. There are people who live in really kind of remote areas where, in Philadelphia, there's an ophthalmologist on every corner and glaucoma specialists all over the place. We're very lucky here in large kind of urban areas, but you can always consult, which may mean make a trip, but then the care can be provided back home. So even if you require surgery, there's always kind of the possibility of shared care, even with complex surgery. So I wouldn't give up your ophthalmologist, especially if you have a great rapport with them, if they're a comprehensive ophthalmologist, or even optometry has really picked up the slack in trying to help with care for glaucoma as well. So, we were talking about advocacy before with regard to patient care. What about, this is a little bit more dicey, and I'm going to pick on Maureen for this again, since of her unique position.
Okay.
How do you deal with insurance and paying for things, whether it's medications or visits or surgeries, and your healthcare plan is just being difficult? How does that work?
I mean, I think this area is just so difficult for everyone. And when I deal with insurance companies, I never throw out the lawyer card because I just don't think it's helpful at all. Because it actually makes things worse. But I would rather give that job off to, not to be funny, but I'm going to my husband, because I really don't want to deal with the insurance company. And I think when things aren't paid for, I'm not an expert in this area, but I think that's part of this problem, that we can't get the care that we deserve because the insurance company won't pay for some of these new technologies. I'm not very helpful on this subject because I don't know what the answer is with healthcare in this country, but I think it's a serious problem. And I know I'm not answering your question, but I think it's something that, in terms of advocacy, I can only do so much in terms of my advocacy and my limits, and insurance companies is something that I don't deal with around my daughter. I deal with on the phone and as a separate issue. But I've had calls from the doctor's office like, you owe this for the surgery. I'm like, well, the insurance company paid for it. And I've had to be on the phone for hours. So it's just another draining thing for a parent. But I do think there needs to be a better solution in this country for our healthcare. I really do.
Okay, I'm going to raise a sore spot here now with Rena. how much time do you think is spent on getting pre-approvals and,
Yeah.
all the time that is spent that wasn't done literally, 10, 15, 20 years ago, trying to get approval for various, whether it's medications or procedures. How much of a drain is that on your
Yeah.
on your practice?
That's a good question. So I'll answer that, and I'll tag on a little bit about the insurance issue as well. And it kind of tags into advocacy, as you said, Maureen. I really love that, because even if you can't really advocate with your insurance company, it's good to let the doctor's office know what you're facing. I prescribe a medication, and I'll be very honest with you, I have no idea what it's going to cost my patient. I just don't know. I don't know what plan they have. I don't know. I mean, I have a general idea of which plans cover what medications, but I don't know what the copay is going to be. And I love it when patients share with me that, hey, this one was particularly expensive. It's not sustainable. And that helps me, not that I would necessarily change their therapy, but maybe they would be an equally good candidate for another drug that is considered formulary by their insurance company. Because the last thing, this is a chronic disease that you're living with your whole life. And we don't want to drain your finances each month just trying to stay afloat, when maybe we can work with whatever your insurance company is covering. So letting the office know, and to answer your question, Dr. Katz, it does drain a lot of our resources. In fact, my office, and I think many other offices, we have hired a team of people that just focus on prior authorizations all day long. They just deal with the pharmacies, and they deal with insurance companies. And it's very helpful to me because I don't have to go through all the red tape. They kind of my team comes to me and they say, okay, these are the patients. This is what you prescribed. These are what's covered. Is it okay to switch? And then, we quickly review the chart and see, is that okay? If not, then, we'll bring the patient in and we'll talk about other options. But it is a little bit of I don't want to say a game, but it is a little bit of something that we have to kind of work around and navigate around. And because we see so many patients, almost every single one of them are on some sort of medication or getting a surgery that may need a prior authorization. So almost everyone that walks in the door is going to need some kind of additional administrative support. So we've had to hire three additional people to help with that behind the scenes while we're seeing patients.
Yeah, first of all, Maureen, I respectfully disagree. My experience with attorneys are that they've been extraordinarily helpful with family members getting things done. I've spent a half an hour on the phone with sometimes talking about emergent surgery and a one-eyed patient. I'll never forget, spent half an hour on the phone, and then I made arrangements to go to another hospital because it wasn't going to be covered. Came out and told the patient and her son. Her son said, give me the number, and took the number. Said, what are you going to do? I'm going to call them up myself. And I said, well, I just spent a half an hour talking to everybody. Came back within 2 minutes, and he goes, here's your approval number. Everything's taken care of. And I said, what did you do? And he goes, I'm an attorney. Never forgot that. So, you do have clout. I mean, it is a trump card.
Sometimes you got to use it.
Yeah. When you have it, flaunt it. I think that sometimes it really is helpful to do that. The industry, especially with innovation, with new technologies, it can be really complicated getting approval for surgeries or devices. And a lot of the companies realize what a burden it is for all of you. So many of the companies have put together kind of almost like patient navigators to help with going through the various channels and the hurdles you got to jump through in order to get approval for the procedure and get insurance coverage. So it's always a good thing to ask your doctor whether there's something like that in place for something that may be quite expensive, something relatively new that you might be a good candidate for. Also, how many people have heard of Dr. Glaucoma? A few people. He's a comedian who happens to be a practicing ophthalmologist. So he's an internet sensation. Relatively young guy, but he's still practicing ophthalmology out in Colorado, and he's absolutely brilliant. And he does these little parodies of experiences with various doctors and patients trying to navigate, for example, the healthcare system and getting through insurance. I died laughing watching it because it's so close to reality, but it's ridiculous what people have to do. So remember, Dr. Glaucoma. You can go on internet and look him up. If you need a quick laugh, he'll cheer you up just listening to him. So this is a question for all of you to kind of think about on the panel. If you had to do it all over again and starting the journey of caring for your glaucoma or somebody in your family, what would you have done differently right off the bat? If you had to go back in time, what do you think would have helped if you really changed the course of your experience and made it better or more successful? Got it? Let me start at your end.
Sure. So for myself, because I was diagnosed so young at age 9, I was fortunate in that my parents were really strong advocates for me. Took me to my doctor's appointments, spoke up for me. So I definitely had that privilege where I don't know that I could have done anything differently at that point because many things were being done for me. I do think that we could have potentially sought second opinions a little bit earlier. Treatment options were a little bit more limited about 20 years ago, which makes me feel old to say 20 years ago. That's what it was. There just wasn't as much, now like SLT is maybe a first line treatment for some people. That was definitely not offered to me. It was drops and then onto valves and a trabeculectomy. So I think, just maybe seeking that second opinion a little bit earlier, seeing if maybe there were less invasive treatment options available earlier on. Other than that, I don't think I would have changed much.
Yeah, I have to agree with that. I'm very fortunate that I grew up in Baltimore and knew about the Wilmer Eye Institute, which is where I have gone for 15 years. And I have had remarkable doctors, every single one. And for that, I am extraordinarily grateful. Thank you, Dr. Johnson, who is now my doctor. But I've been very lucky. It's been a difficult journey. I've been thrown quite a lot of curves, and I have lost a lot of vision. And I don't know that I would change anything because, as you said, 15 years ago when I was diagnosed, what is in place today was not in place. The first physician that I went to in Pennsylvania told me you need laser surgery right away, but the physician never told me that I had glaucoma. Right. So, yeah, I made an appointment at the Wilmer Eye Institute that week and met a remarkable doctor there, Dr. Derek Wellsby, who now is in Catalyst for the Cure for the Glaucoma Research Foundation. And he performed my first surgery, which was the barbell shunt, which was a big surgery, but it saved my vision. So I don't know that I would change anything, other than not having glaucoma, but but I have been very, very fortunate that I have been in close proximity to the Wilmer Eye Institute, and forming the relationship with the Glaucoma Research Foundation was probably one of the best things that I did. So I'm very grateful for the relationships that I have with the people there and what we've accomplished. So things are good.
I think getting rid of, and I hate to use that term, but I'm going to, the pediatric ophthalmologist earlier. But in terms of this question, I look at this as how are we going to do things moving forward? Because as a parent, and many of you are probably parents, we beat ourselves up probably about things we've done. And moving forward, I intend to continue to advocate. My daughter, when she was 18, had to get a tubular shunt surgery, and they wanted to do it on her birthday. And I said, are you crazy? We're not doing this on her birthday. She never knew this story. And so as a parent, I feel for my, in terms of my advocacy. And on the day, 2 days after her birthday, she had to sign an advanced healthcare directive. Okay, so that's a document, I think that everybody should have, if in terms of advocacy and power of attorney, because we all need other advocates. We all are not great 24/7. So looking forward, I love to exercise. That's a big thing that helps me. When things are stressful, I love to run. I love to get out there. So that is to get yourself in your own space and not necessarily think about glaucoma. And there's so many advancements. So hope is my message here. Through running, I got involved with the Glaucoma Foundation. I ran a marathon, and I gave the money to a spot to the Glaucoma Foundation. So that's another form of advocacy. So I don't have any regrets. I'm always learning, and that's the future is my my answer to your question.
Great answers. Thank you so much to the panel. Let's all give them a hand for sharing their experience.